Okay, so we are going to talk about the postpartum adjustment, and we are going to be focusing on postpartum mood disorders. So there are several adjustments that your body and your mind and your spirit are going to be making in the postpartum period. You've just given birth to this beautiful human being that you're so excited to have. And now you're going to be exploring all of these new roles. What is my purpose? What is their purpose? What does our family dynamic look like? And all of these things are going to be impacting your total postpartum experience. So, physically, you're going to be changing. Your uterus is going to go from your fully pregnant size and it's going to continue to contract down to its pre pregnant size. And your chest is going to start having more fullness and you're going to be nourishing your baby. And your hormones are going to be changing. You no longer have the placenta that is producing pregnancy hormones. So around day 3 to 5, usually it's with the onset of mature milk, your hormones are going to crash. And it's very typical to experience what we call the baby blues. And it usually resolves within a couple of weeks. And the most common symptoms are sadness or just really overwhelming feelings of joy or emptiness, uncertainty, just all of this change can feel really big and you can just feel a little bit weepy, and sometimes it's for nothing and sometimes there is something that's causing you to feel weepy. Postpartum depression, however, is going to last longer than that couple of weeks, and typically it's going to worsen over time. Some of the symptoms are going to be emotional instability, overwhelm. It can be that extreme fatigue, not desiring to take care of yourself, not desiring to take care of your baby. It can be anger. It can manifest as rage. It can manifest as just irritability. There are so many symptoms that are not typically addressed that you don't usually associate with the word depression. Uh, Postpartum psychosis is the most extreme form of postpartum depression, and it does require immediate treatment. And that typically is going to involve putting them into psychiatric care. Postpartum OCD is often socially, they kind of get mixed up. Postpartum OCD is these intrusive thoughts about harming your baby or bad things happening, but the parent is terrified of these thoughts. They don't want them to happen, but they have this compulsive need to avoid situations that are inducing those thoughts. So they may compulsively close the cupboards so they don't see knives or knives aren't around, things like that are keeping them away from situations that may harm their baby or cause them to harm their baby. Postpartum anxiety disorders, there are many of them. Uh, they may be panic disorders where you are having panic attacks, that your anxiety is just so high that your body is constantly in this fight or flight state. Postpartum uh, OCD can also be in there. And then postpartum post-traumatic stress disorder is also part of this anxiety. So some of the risk factors, I'd like you to tell me, what are some of the risk factors that you think there may be? Okay. So risk factors include a history of postpartum depression where if this is your first baby, you're not going to know if you have a history or not. But being a first-time parent also puts you at risk of having postpartum depression, postpartum mood disorders, um, especially if there are other stressors in your life. So that's going to include financial instability, intimate partner struggles. So it can be intimate partner violence or just you're not on the same page. Um, Food insecurity is also a risk factor, and having a traumatic birth, having your baby stay in the NICU, if it was an undesired pregnancy, all of these things can lead to kind of this culmination of a postpartum mood disorder. Um, but there are things that can be done. So having sufficient support is one of the biggest things that you can do to help prevent the manifestation of postpartum mood disorders. So that includes having family leave, um, income support, having a support system, people that are coming in just to check on you, having friends and family that can help get you out of the house, having a good postpartum plan and how you're going to take care of yourself and what your expectations are. So, setting realistic expectations for what the postpartum looks like, getting sufficient rest. There are supplements that can be taken. Uh, like your fatty acids, your omegas. There are herbs that can be taken. You can make sure that you're supporting your body nutritionally. I have a recipe book that is in the handout that I will give you at the end of this class. And it has recipes that are really great for supporting the postpartum body. Um, so you can make those as freezer meals so that you have them ready to go. Supporting your body nutritionally is super important because you are going to be nutritionally depleted postpartum because your baby is taking from you to get everything that they need, whether you're continuing to get more of that or not. Um, and then also make sure that you're staying in touch with your care provider, whether that be a midwife or an OB. Seeking therapy can be an effective way to manage postpartum mood disorder symptoms. Um, Support groups, finding a local support group, or even like new parent groups can be a really great way to feel that support as you are making this transition into new parenthood.